Hello, this is Dr. John Hoy, physician and surgeon of the foot and ankle, practicing in the heart of downtown Seattle, Washington. Welcome to my treatment room. Today we're going to be talking about foot ulcer treatment. For more complete documentation, please visit my video entitled Diabetic Foot Care. We, in this office, treat a lot of diabetic wounds. And what we do is to prevent patients from losing their feet. There have been a lot of high-risk populations that I've worked with in my career, with patients with diabetes, Hansen's disease, and Buerger's disease. I really have a passion for this work. I've practiced in some of the most hard-hit areas of wounds and infections from wounds in the country, including the Veterans Hospital in San Francisco, which has performed the most diabetic foot surgery in the San Francisco Bay Area. And I've also worked in San Antonio, Texas. This is an area where diabetes is endemic and where wounds and limb salvage is a very big part of the practice. I've also worked in the Wound Healing Center here in Seattle and helped with the residency program and supervising the residents in foot and ankle surgery in the Wound Care Center. So what is at the heart of the condition is some patients may have poor nerve sensation, which is called peripheral neuropathy, and it makes patients unable to feel sharp objects or sores in their feet, and this leads to infection. Patients may also have poor circulation in their feet. This is called peripheral vascular disease. This keeps and prevents nutrients and infection-fighting cells and antibiotics from getting to the feet. This then causes infections to spread quickly or causes tissues to die, and this is called gangrene. Some of the common causes of peripheral neuropathy and peripheral vascular disease include diabetes, smoking, and alcohol abuse. People with diabetic foot wounds have a higher mortality rate than people affected with Hodgkin's disease, breast cancer, and prostate cancer. So limb preservation is a very important science. One of the components of limb salvage, what we call prevention, is that regular examinations are necessary to limit the risk of limb loss. For example, making sure that the nails and calluses are trimmed back to a safe length and thickness to prevent sores from developing under or around them. We also make sure that circulation tests are performed to get ahead of the peripheral vascular disease and follow up appropriately if there is a problem with circulation. If there is a limb-threatening infection or wound, then there are various treatments that can help them. First of all, it's important to off-weight a wound so that it can properly heal, so that you're not continuing to walk on them. There are various modalities and inserts and supportive shoes and casts and walkers that can be done, can be used to help off-weight the ulcer. Also, hospitalization may be necessary when there is an infection and there are signs that the infection is spreading throughout the body. Consultation with other specialists are needed, including with vascular surgeons, to make sure that enough circulation is going to the feet to allow the ulcer to heal. Also, surgery may be necessary to clean out all the infected parts to allow the ulcer to heal correctly. For example, the ulcer may need to be cleaned out to get rid of all the dead tissue. Also, if the ulcer is deep and bone is infected, then certain parts of the bones may need to be removed to enable the wound to heal correctly. Reconstructive foot surgery may also be needed to help to heal the wounds. For example, if there is a deformity such as a hammer toe or a bunion, those need to be fixed so that the wound is able to heal correctly. These methods also prevent future wounds from occurring. By having regular care, problems can be prevented and solved. That's diabetic foot ulcer treatment. Thank you very much. And as always, take care and have a great day.